So what are the consequences of your loved one saying no to treatment? And it almost goes back to the video on the excuses families make to not do an intervention or wait to do an intervention website of what if they say no. And guys, these are questions we need to be asking you. So if we do an intervention with your family and your loved one and they say no, what are your consequences? What is the accountability? If your individual solo loved one who's overpowering 3, 5, 8, 10, 15 people in the family, through manipulation and excuses and anger and fear and resentment and all their other behaviors that fuel addiction and put you in what families love to say a holding pattern, which I've never understood. It's just an excuse to say that. Is that families have to understand that the consequences they set is a question that we have to be asking you. What are you going to do when they say no? Because it comes back to, if they say no, what they're saying is I'm going to continue to run the show. I'm going to continue to use drugs and alcohol. I'm going to continue to not stay med compliant for my mental health. I'm going to continue to not address my dual diagnosis. And you are going to put up with it. You're going to pay for my mistakes. And you're going to let me do whatever it is that I want at your emotional, financial, spiritual, and sometimes physical, and of course, mental expense. So this isn't see, when you say, what if they say no? What are the consequences? It's like, that's on you. We educate you, we prep you, we teach you, we provide you, we guide you, we do everything we're supposed to do. And it's ultimately on you as to whether or not you understand the science. Guys, we're not coming up with family first interventionisms. This isn't the Mike Laverty show. Some may think that it is and it's not. We come from a place of evidence-based treatment. And yes, some of it is a little bit more than others would like to do. Today, therapists are very into coddling clients and empowering them and meeting them where they're at and rolling with the resistance. I've never seen that work. I assure you of that. But there's also a fine line in the best course of action because every client is different. But at the end of the day, nobody goes to treatment when things are going well. Nobody says, hey, my wife asked me to renew the vows. I just paid off the mortgage, just bought a new car. Boss just gave me a promotion. What are those AA guys doing this morning at that meeting? Nobody does that. They walk in there being beaten to a state of reasonableness and having to suffer consequences as a result of their actions and their behaviors. So our job is to help the family identify what consequences are you shielding from. So what are the consequences of them saying no? They need to be there. Whatever those consequences are, they have to be their consequences. You got to stop holding the bag.